HIV, AIDS. A word that once struck fear into the hearts of millions. A diagnosis that carried shame, stigma, and a sentence of isolation. In Nigeria, the fear of HIV was once as pervasive as the disease itself. But today, something has changed. Nigerians are no longer terrified. They are learning to live, to fight, and to thrive, despite HIV. The fear that once surrounded HIV, AIDS in Nigeria is gradually fading, replaced by knowledge, treatment, and a growing sense of empowerment. When HIV first emerged in Nigeria, it was met with confusion, panic, and denial. With limited knowledge about the virus, many saw it as a death sentence. The government, healthcare system, and society were ill-equipped to handle the outbreak, and fear spread faster than the virus itself. The battle was not just against the virus, but against an even more insidious enemy, fear. Fear that drove people into silence. Fear that kept many from seeking the help they needed. Over the years, education, advocacy, and grassroots efforts have slowly broken the silence. Public health campaigns, community outreach programs, and support groups have gradually demystified HIV. Nigerians are beginning to understand that HIV is no longer the death sentence it once was. Education has been a key part of this shift. With better access to information, especially in rural areas, people are no longer afraid to learn their status. They know that knowledge and treatment can change everything. One of the most powerful tools in this transformation is antiretroviral therapy, ART. Available for free in many health centers, ART has given people living with HIV the opportunity to lead healthy lives, just like anyone else. People living with HIV are no longer alone in their struggles. Support groups and networks of people living with HIV have empowered individuals to share their stories, to support one another, and to fight against the stigma. Young Nigerians, especially, are leading the way in challenging misconceptions about HIV/AIDS. With better access to education, technology, and social media, they are spreading awareness and reshaping public opinion. Through social media, youth in Nigeria are actively engaging in conversations about HIV prevention, testing, and treatment. The stigma is slowly being replaced by an open dialogue about responsibility, health, and empowerment. While progress has been made, challenges remain. There are still regions where access to care is limited, and misconceptions continue to persist. But with increased funding, improved healthcare access, and continued education, the future looks hopeful. HIV is no longer a sentence of fear and despair. Nigerians are living proof that with the right information, resources, and support, fear can be conquered. Today, they face HIV with resilience, knowledge, and hope for a future without fear.